Welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and in this video D1, we're going to cover how to develop a business plan for IV chelation services that's financially sustainable, strategically sound, and set up for long-term growth. As always, here's our quick disclaimer. This training is for educational purposes only and does not replace professional legal, financial, or clinical advice. Always consult the appropriate experts when building or expanding your practice. Now let's talk business. A well-designed business plan does three critical things. 1, it clarifies your vision, how IV chelation fits into your practice. 2, it helps you analyze risk and opportunity before you invest. 3, it allows you to plan for profitability with realistic cost and revenue projections. Whether you're pitching to investors or building a solo practice, a business plan is your roadmap to success. Let's walk through the 5 essential steps to build your IV chelation business plan, starting with the most important, market research. Start by understanding your local market. Ask yourself, who else is offering IV chelation in your area? What are they charging? Are they focused on detox, longevity, or heavy metal removal? Once you've gathered data, complete a SWOT analysis. Strengths, what unique advantages does your practice offer? For example, integrative approach, in-house lab testing. Weaknesses, what might hold you back? For example, staff training, limited marketing reach. Opportunities, are there underserved populations nearby? For example, industrial workers, veterans, chronic illness communities. Threats, what regulations, competitors, or public perceptions could hurt your growth? This step gives you a strategic lens to make smart decisions early. Now that you understand your landscape, it's time to get clear on who you're serving, your target demographic. Here are some high-potential patient segments: occupational exposure, construction workers, mechanics, welders, painters, factory employees exposed to lead, mercury, or solvents, chronic illness communities, patients with chronic fatigue, fibromyalgia, autoimmune conditions, or mystery symptoms who haven't responded to conventional care, parents of affected children, families concerned about developmental delay, especially those living in older homes, wellness clients, health-optimized clients interested in detox, anti-aging, or preventative protocols. Tailor your messaging and pricing based on what motivates each group to take action. Now let's talk numbers, costs, pricing, and projected ROI. This is where many practices stumble, but with a little planning, it's easy to build a profitable chelation line. Start with your startup costs, initial supplies and equipment, IV pumps, chelation agents, sterile kits, infusion chairs, staffing, infusion nurse wages or training costs, marketing, website updates, ads, printed materials, legal and admin, EMR templates, malpractice coverage, consents. Typical startup $5,000 to $15,000 depending on scale. Next, plan your monthly expenses, medication resupply, staff time, lab tests, rent, utilities, if applicable. Then estimate revenue. Here's a conservative example. You charge $250 per infusion. 20 patients per month equals $5,000. Subtract monthly overhead equals $2,500 to $3,500 net profit per month. ROI on startup costs, 2 to 4 months. Add in package deals and add-on services like nutrient infusions or detox panels, and your margins can scale quickly. Let's summarize the key points. 1, start with market research. Know your area and what others are doing. 2, do a SWOT analysis to prepare for challenges and spot opportunities. 3, identify your target demographics, so your messaging and service delivery match what they care about. 4, build a realistic budget and ROI model to track your performance from day 1. In video D2, we'll break down billing, coding, and insurance, including how to handle cash pay patients, documentation for reimbursement, and the CPT codes you need to know. Thanks for watching video D1 of the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and I'll see you in the next video.